Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 353. Hello, True Health Seeker, and welcome to another exciting episode of the Learn True Health podcast. I'm really excited to bring you today's interview because the information is so life-changing for those who need it. Even if you don't have pelvic floor issues, you'll want to listen to today's episode because she also teaches preventive measures to help us sustain a healthy pelvic floor. Every woman knows someone who has pelvic issues. This is a really big deal, and a lot of people don't know that there is help. So today you're going to learn about the natural and effective ways to create a healthy pelvic floor. And for some people, like I said, it will be life-changing information. So I'm very excited to bring this to you today. Now, please visit learntruehealth.com because in the show notes of today's podcast, there are some free resources that have been provided for us. Also, while you're at learntruehealth.com, I want to let you know about a few other resources I have created for you. We have a 7-day workshop that's delivered by naturopathic physicians to teach you the foundations of health. You should definitely apply for that. It's free. So just go to learntruehealth.com and put in your email, and every day you'll be given a video by one of the naturopaths that I've worked with. Also on the website, in the menu bar in the upper right-hand corner if you're on desktop, or just click on the little menu bar if you're on your phone, there's Ashley Recommends, and that takes you to a part of Amazon where I have picked out all the things that either past guests have talked about being really helpful, or I have in my home that is really helpful for me. So kitchen gadgets and all kinds of wonderful health goodies, including my absolute favorite replacement for the microwave. So if you are like me and you don't use a microwave because you know of the unhealthy effects that microwaves can create, or if you've never heard of that and you're going, oh my gosh, wait, are you saying I use a microwave every day? What's going on? I put my plastic container in the microwave. What do you mean that's unsafe? Yes, absolutely. We've talked about it in past episodes. I won't get into the details here, but there's a replacement for the microwave that is safe and healthy, and I have it in the kitchen section. So just go to learntruehealth.com and click on Ashley Recommends, and from there you will see my absolute favorite health gadgets and the wonderful goodies. There's lots of resources on the Learn True Health website, including most recently, we've now started to transcribe all of the interviews that we're posting. So you can go to the most recent interviews at learntruehealth.com and you can actually read what the guest has said, which is so helpful because the feedback I've been given by listeners is that they'll listen to episodes sometimes 2 or 3 times while taking notes because of how valuable the information is that's being delivered by the experts that I have on the show. So now it's going to be a lot easier for you to be able to go through that information because we're transcribing the interviews. Excellent. Well, thank you so much for being a listener. And I know you're going to share this episode with those you love because, ladies, if we laugh when we pee, that means we have pelvic floor dysfunction and we can correct it. And men can have pelvic floor issues as well. If we have a pelvic floor issue, we can have pain, incontinence, pain during intercourse. And for children, they can have problems potty training or wetting the bed. So this is not just a female issue, but it's very common for women after giving birth to have a pelvic floor dysfunction. And the most common thing we hear from women after we have had a few children is that we laugh when we pee. Well, guess what? There's a way to correct that, and you're going to learn it right now. We are in for such a treat today. We have with us Katie Tredo. She's an amazing physical therapist who specializes in pelvic health. Is it only for women, the pelvic rehabilitation?
No, I treat men, women, and children.
Okay, this is cool because I know before we hit record, we were talking about postpartum health. And when I think of pelvic rehabilitation, I think of women after giving birth and how how kind of messed up we are in that area. But it's interesting that what you do
Yeah.
helps. It can help everyone.
And I see a lot of women who have never given birth too.
Interesting. Well, just yesterday, a morning, I was with a girlfriend and I said something funny, and we both keeled over laughing, and she said, "Stop it, you're gonna make me pee." And of course, I was already peeing because I didn't know that this was such a common problem that women can develop after having children. And
Yes.
I was told that I should see a pelvic rehabilitation practitioner because there are exercises and things we can do to restore our pelvic floor so we don't have these accidents every time we sneeze, cough, or pee. Or I mean,
Right.
sneeze, cough, or laugh. And so that really piqued my interest in hearing what you have to do, but you do so much more than that. We're going to get into your story and what is pelvic rehabilitation and how do you know that you need pelvic rehabilitation. But before we get into all that, I wanted to let the listeners know that Katie is actively in our listener Facebook group, the Learn True Health Facebook group, and she's actually going to do a giveaway for the listeners. So after you hear this episode, please come into the Facebook group and join the giveaway. It's a little bit unrelated to pelvic health. However, it is linked to Katie's story. She sells a healthy sunscreen, and we're coming into summer here in the northern hemisphere, and I keep seeing articles about how sunscreen enters the bloodstream. It's
Yeah.
really scary that these toxic, sunscreens sold in the stores have carcinogens, have endocrine disruptors, and they enter our bloodstream. And we think that they're protecting us from skin cancer, but they end up damaging us in a different way. So, Katie, can you talk a little bit about the natural sunscreen that you sell and that you're going to be giving away to a listener in the Facebook group?
Yeah. So I partnered with a company about a year and a half ago called Beauty Counter that's based out of Santa Monica, California. Now, years back, my husband and I were dealing with unexplained infertility. And at the time we started researching what we were eating, what was in the products we were using. And I was blown away when I learned how many hormone disruptors are in our products that we were using. And at the time I switched to things I thought were safer, but a while later learned as I joined Beauty Counter and learned about different things that there's a loophole in the United States that a company can claim to be paraben free or phthalate free and have fragrance on their label, and that allows them to put any number of chemicals that without disclosing what they are. So it kind of undoes the claim on their label, and it's just something that exists in the US. So of course I'm like so curious going back and looking at what I'm using, and everything in my bathroom had fragrance in it. So that was a little bit disheartening. And I started using Beauty Counter with my family and getting more passionate about educating people what I had learned, because in the US, there's only 30 ingredients banned from our personal care products. And the FDA has virtually no control or regulation over the industry. So by joining Beauty Counter, I've been able to educate people and as well as advocate at the government level for change in the regulation. It's been so much fun. And like pelvic health, it's kind of that like once you know it, you can't unknow it. So one of my very favorite products with Beauty Counter is the Beauty Counter Counter Sun Face Stick, and it's a safe mineral-based sunscreen that I love for both myself and my kids. So one of your listeners will get that. It uses non-nano zinc oxide, so it doesn't absorb through the bloodstream. And it's unlike those chemical um, sunscreens that are getting a lot of press right now for showing up in the bloodstream. This is not absorbed. And then, besides our own health, sunscreen also impacts our environment quite a bit. So,
Mm.
this year, Key West joined Hawaii in banning chemical sunscreens. So, they do not sell chemicals sunscreens anymore because it was killing the coral reef in those areas.
Yeah, I heard that. And I also thought I heard somewhere in Australia that they also banned it because it was killing coral reefs.
Yeah, that could be. I'm not sure.
Right. Now you mentioned 30 chemicals are banned from our products. Do you know how many are banned in Europe? I've heard the number is way
Yeah.
higher.
So Canada has 600 ingredients banned, so they're slightly
Jeez.
ahead of us. And Beauty Counter is in the United States and Canada. And actually, some of our leaders in Canada just were up there uh, lobbying for better regulation in Canada at Parliament this past week. I just saw pictures. And Europe bans over 1,400 ingredients. So there
No.
are 1,400 things in Europe that have been found to cause adverse health reactions. And in the US, we only recognize 30 of these, including we still have
No.
formaldehyde in our products.
No. Well, not in the products you sell, but in in
No.
America.
Oh, not in ours, no.
Oh my
And so Beauty
gosh.
Counter kind of goes above and beyond and has over 1,500 that they have found that can either absorb in the bloodstream or cause an adverse health effect. And they just kind of go by the theory something has to be proven innocent before it's used in a product. So we don't wait to find out bad research about the ingredients we're
Mm-hmm.
using. We make sure they're safe before putting them in. And actually, they just partnered with Tufts Medical School this year to provide medical research on all of the ingredients we're using.
Cool. I was
Yeah.
just early this morning, I was at Home Depot and I was like, "Oh, I ran out of my, all natural cleaner for something, some kind of
Hmm.
household cleaner." And so I'm looking through other cleaners. I'm like, "Can I find a safe one?" And there's this one that it's called like green something. I don't remember the name, but I'm like,
Yeah.
"Green, that has the word green in it." So you think it's like, "Oh, this must be their biodegradable, non-toxic, all natural one, right?"
Yeah.
And I flip over the other side and it has that big warning, like in California, ingredients have been known to cause cancer. I'm like, I don't trust this entire company because
Yeah.
they call themselves green, like in the name,
Yeah.
and it's just it's so frustrating that companies try to be quote unquote green and
100%.
and then they're using things that are known carcinogens, like they're
Yeah.
poisoning their customers because it probably profits them to do so. So just to recap, in the in Europe, 1,400 chemicals are banned from their products versus our 30.
Correct. And this is even more alarming is the last time we had a major law passed on the personal care industry was in 1938.
No.
Yeah. But there is one right now on the Senate floor, the Personal Care Product Safety Act, and Beauty Counter was largely involved in getting that introduced in the Senate, and now we're asking people to support that. And I like to talk about this because then it makes people understand why there is a need for better regulation.
Mm. It reminds me of the Wild West, where these I could start a company tomorrow that sold some kind of face cream or some kind of cosmetic, and I could put almost whatever I want in there, as
100%.
long as it didn't have those 30 chemicals that are banned here, but I
Yep.
could put whatever I want in it.
And to even take it to another level, the FDA can't even inspect where you're making this product, and it never has to be tested for safety before it's sold.
Wow, that's
Right? Alarming.
it is alarming. But I'm learning about like our clothing. When we buy new clothing, you always try to buy organic cotton as much as possible. But
Right.
when we buy clothing, the clothing is infused with formaldehyde because
Yeah.
otherwise the clothing, when it's a textile, before it's made into a garment, it could go moldy. And so
Mm.
they basically spray it with all kinds of chemicals, and then people don't know to wash their clothing after they buy it, and it's skin, it's direct contact with our skin. And my husband got a pair of jeans once from a well-known jeans manufacturer, and he just put them on right away. And I always wash stuff, but he's like, "Oh, whatever, I'm in a rush." And he got a full rash from his belt all the way down to his ankles.
Wow.
Yeah, and our naturopath said absolutely, it's the chemicals they're putting in our clothing now. It's just getting worse and worse.
Yeah.
So we are the ones that advocate. So this is our me on my soapbox. The Learn True Health podcast helps us all to understand through wonderful guests like you that we need to be the experts, in a sense that we need to do a little bit of research before we go buy things. And
Right. And that every dollar you spend is putting a vote towards
mhm.
what you believe in.
Mm-hmm, absolutely. So I love that you advocate for a healthy sunscreen. We're coming into summer. We all should have a healthy one. And you know what? No, there's nothing wrong with getting some sun every day on bare skin. That's really great. But if you do buy sunscreen, buy one that is non-toxic. Obviously, you want one that doesn't have the 1,400 chemicals that are
Right.
banned in Europe in our sunscreen. Awesome. All right. So that had nothing to do directly with pelvic health, but it does have to do with health in general, and it does have to do with your story. Let's dive into your story, Katie. Please share with us what
Yeah.
had you want to become a doctor of physical therapy and specialize in pelvic health and pelvic rehabilitation.
Yeah. Well, I can admit right now that when I was in PT school, I remember someone coming in, and at the time I was in school, we really didn't talk about pelvic health that much, but we had someone kind of introduce the topic of it to us, and I remember specifically saying in my head, who would ever specialize in that? And here I am, but it's been the motto for everything. Whenever I say I'm not going to do something, it happens. I actually am one of those people who I knew what I wanted to do from a very young age. And when I was in eighth grade, I had met a family in my hometown that had a child with cerebral palsy, and
Mm,
I began babysitting, and they were such an awesome family, and I had an interest in working with children with special needs, and they let me go to all the PT appointments. I traveled
cool.
with them for a surgery their child had, and it just really piqued my interest. And so I knew from that point on I wanted to go into physical therapy. And I was 100% certain that I would end up in pediatrics. Um, so I did take my first job was a cross between pediatrics and spinal cord injury. I was very fortunate in one of my internships to work with a physician that was working with Christopher Reeves in St. Louis at the time, um, with spinal cord injury. And at the time, he had been asked by Johns Hopkins to come out to Kennedy Krieger Institute in Maryland and start this International Spinal Cord Center. And I happened to be graduating at that time and was able to jump on and be part of that process, which was a really amazing opportunity.
That's so cool.
After about 2 years, I felt between pediatrics and spinal cord injury that I was becoming so specialized in an area that if I had left Baltimore, um, which I plan to do someday, where would I ever find a job that would compare to this clinic? We had patients from all over the world flying in, and um, I met my now husband, and we decided he had been doing travel physical therapy and was actually hoping to stop doing that, but I was very convincing. And we left Baltimore and just started traveling around the country doing different contract jobs. And um, I got a taste of what working in different environments was like. So maybe 15 weeks at an outpatient orthopedic practice, maybe another 3 months at a nursing home, and just seeing the different areas that you could work in as a PT. And I found that I really missed working with these major quality of life issues. And the thing I think that drew me to pediatrics and to spinal cord injury were that you weren't only treating someone for something like an ankle sprain or this injury that might impact a little bit of their life. You were changing their world, or helping, not even you were, but you were helping them to change their world and providing this education to get them beyond that point in their life. Um, and that to me is what gives me that's what I'm passionate about within PT. So it's not that I don't think these small injuries need rehabilitation. Of course they do. Um, I just really liked working on these big issues. So we were living in Hawaii for a year, and it's kind of, I don't know what it was about pelvic health, but I just kept reading more and more about it. And I found a pelvic health practitioner in Hawaii, and I met with her and made her give me a list of what classes do I need to do? Where do you think I should start? And um, how do I do this? And so my husband and I were getting ready to move back from Hawaii. And I, when I have something in my head, I have to do it right away. So on our transition to moving to Boulder, Colorado, I had a 4-day layover in Seattle, actually, by you, and took my first pelvic health class, and then landed in Denver to interview for a job to start a pelvic health clinic, which was courageous at the time, but I really wanted to learn as much as I could. So the next several years I spent flying around, taking different seminars and courses, and learning as much about the topic as I could. Um, so the type of people that come in my clinic, I know you had said like postpartum is what you think of. And that is definitely a part of my practice. But the kind of issues that I'm dealing with patients are I have people that come in that have such severe pain that's preventing them from having intercourse with their partner,
Mm.
or they can't tolerate sitting at a meal with their family, sitting on an airplane or a bus to travel. They can't engage in social activities. Patients that leak urine and feces, and it can be anywhere from, like you said, you're laughing with a friend and having a little bit of leakage to people who feel so isolated that they are afraid to leave their house because they're embarrassed to leave. And then I work with children, and some of these kids are kids that don't go to sleepovers because they're scared they're going to have bedwetting, or they're nervous to play sports or be involved in things at school because they're scared they're going to wet their pants and they're beyond the age that that should be happening.
Mm. Very interesting. So it can be anyone, and it's
Yep.
usually either, so you're saying it's pain or discomfort, or that they're having incontinence in some way. Are there any other symptoms so people would?
Yeah, so I treat people with prolapse, and then I treat a lot of men as well. So the my patients with pain can be both male and female, and then I do see a lot of men who have had prostate cancer and are having incontinence after surgery.
Mm, okay. Any other male issues like erectile dysfunction or any other issues that are common for men to come see you?
Sure. So usually they present with either incontinence or pelvic pain, but along with the pain, especially, or with the incontinence actually, they can have erectile dysfunction as an issue as well with that. And, I'm working closely with urologists, so sometimes they're testing different medications, those kind of things. But when there is a dysfunction in the pelvic floor, it can impact the blood flow to the area and those sorts of things. So a lot of times men report that their erections improve after doing pelvic floor therapy.
And what about women's sexual issues, or like did they also improve because blood flow, so do women
Yeah,
find that they have improvement and sensation with their partner?
100%.
Very interesting.
And I really advocate kind of taking a holistic approach with these things. And so I do work with a lot of patients with sexual dysfunction, and while the physical part is part of my job, I really like to be in a network of whether it's a sex therapist or a psychotherapist or that can also help these individuals or couples work through some of these issues from more the emotional aspect as well.
Mm-hmm. Right, because we will beat ourselves up and we'll feel anxious about it, or maybe we've had trauma in our past.
Right.
And so, yeah, because we often will have emotional issues either because or around having, not being able to perform in that area or not feeling good about ourselves in the area. So yeah, I can see that there's emotions that can come up.
Yeah.
But if someone's, doesn't have any emotional issues and then they end up not realizing that something is not there's not optimal health in their pelvic floor, that can lead to sexual dysfunctions and like incontinence and pain and these other things. So it can develop you can develop emotional issues because you had something physical. Right.
100%. I actually was looking up some stuff recently just about incontinence in particular, which surprised me because I thought I'd see more of this with pain, which is very isolating, and there's a lot of psychosocial stuff that comes about after realizing you're in pain. But for bowel and bladder, which you know, when you maybe leak a little when you laugh, you don't think this could be that serious, but bowel and bladder incontinence is highly linked to suicidal tendencies. And in one study I read, 70% of people interviewed felt that experiencing incontinence would be worse than death. Um, in the United States, it is one of the top reasons for nursing home admissions, and fecal incontinence is the second reason why a person would put an elderly family member in a nursing home.
Mm. Wow, our society is it's so different, from other cultures that, that we would never, there's cultures that would never dream of putting their parents in a home, and they just take care of them no matter what. But, we
Right.
in our society want to be very clean and sanitized and kill
Yeah.
99.9% of bacteria and hand
Right.
soaps, and we want to be clean. We want everything
Right.
sterile. So tell me about this pain that people experience. What is causing pelvic pain?
So pelvic pain is a huge area, and there are so many different causes and different pain conditions that it's hard to see in the research what the true incidence of this is because there's so many different names. And as a medical community, it hasn't really been, everyone uses different words, so it hasn't been standardized. So there can be very different reasons people have pain. There can be nerve pain in the area from the pudendal nerve. Sometimes a hormone disruption will cause pelvic pain or changes in the pelvic floor or the vestibule area, which is like the entrance to the vaginal canal. Another thing that is fairly common is vaginismus, which it's a condition where the pelvic floor is like spasmodic. It's painful and it's a contraction of the vagina in response to physical contact or pressure and oftentimes intercourse. So this is one condition I see a lot of, and often patients, if they have primary vaginismus, maybe as a teenager they tried to use a tampon and it was very painful, so they just stopped doing it. They avoided medical exams there, and then they go on later in a relationship and they go to have sex for the first time and they can't. They feel like there's a wall blocking them. They feel, some of them describe to me that it feels like knives are stabbing them. And they think they're broken. It can destroy relationships. And this is truly a problem of the pelvic floor. And so, through physical therapy, they can learn relaxation techniques, be educated on their pelvic floor. We do a lot of in clinic techniques, but a lot of education and, between sessions, the patient working either by themselves or with a partner to relax these muscles. And this is one of my well, it's a terrible condition to have. And so I hate when someone walks in and has this, but it's one of my favorite conditions to treat because someone comes in scared to tell anyone that they have this problem and they haven't admitted it to most people in their lives. They feel like their husband's married someone defective. I hear all these horrible
Mm.
self-deprecating stories, and when you can sit down with someone and say, I see people with this all the time, and there are things we can do to get you past this. And um, one of my favorite success stories was a patient in Maryland dancing, and at the time I had a cash-based practice, and so for her and her husband, it wasn't their insurance didn't have good reimbursement, and it wasn't feasible to come super often. And they were both very dedicated, so I would teach them ways they could work on this at home. And so I'd see her kind of spaced out, and as she was getting a little better, more and more spaced out. And then I stopped seeing her, and you always wonder what happens to these people that you're not seeing. And I got an email months later from her, and she said, Things have been crazy. I never got time to thank you, but I wanted to also let you know that because I was never able to have intercourse or even a pelvic exam, I never in my life thought about preventing pregnancy. And I just want you to know that we're happily expecting our daughter in September. And it just made my day because here was a couple who had never been able to have intercourse and they were growing their family and having pain-free intercourse.
Oh my gosh, I love it. That's amazing. My I think one of my midwives or my doula told me, like, because I was talking about doing Kegel exercises to correct the, peeing after
Hmm.
laughing from birth. And one of them said, well, wait, don't do Kegels because sometimes the problem is having like the wrong muscles be too tight and other muscles be too loose. And so she was trying to explain that like pelvic floor health is so much more than just doing Kegels. Can you talk a bit about that?
Yes, 100%. And I just want to make a side comment too that I love these people you're talking to because your friend that you were talking to that recommended pelvic floor therapy, and this doula you were talking to, it's not common. Like, I can't tell you how many times I'm in a conversation with women and they laugh at that they're leaking urine, and their doctors have told them, oh, it's just part of having kids. And I sound like a broken record at my clinic because I'm constantly telling people this is common but not normal. And it is something you need to work on. And it's something that goes beyond just that little bit of leakage. It's part of your anticipatory core muscles, and it changes the way you move and injury prone and all of that. So I am very excited that you're having these conversations. As far as your question now, that is 100% accurate. So that is probably the thing I get most is people calling friends that live in different areas that can't come in asking me, should I just do Kegels? And it is very hard to answer that question because if someone has pelvic floor weakness, which is very common, especially after having a child, they can present with incontinence, prolapse, some musculoskeletal dysfunctions, back pain, and they indeed need to strengthen their pelvic floor. So, making sure they're contracting the correct muscles is important, and making sure they're able to relax their muscles. So, I also, on the other side, have patients that maybe are experiencing frequent urination and overactive bladder symptoms, and they may think that they need to do Kegels as well, but they might have a hypertonic pelvic floor. So the muscles aren't incapable of relaxing. And so in those patients, the last thing I'd want to tell them to do is to go home and do 20 Kegels. So it really depends on an exam. And whenever I see someone for the first time, I explain that it can be anywhere on that spectrum, and that through an examination, we can determine where's a good place to start in an appropriate plan of care.
How do you examine the pelvic floor? I'm imagining it's like getting a pap smear. Like I'm just in my mind, I'm like,
Yeah.
how else would you examine a
So
pelvic floor?
So it's less scary than a pap smear, in my opinion. It is an internal pelvic exam. There's no stirrups involved, so you're just lying with your knees bent on a table. I don't use a speculum or a device like that, so it's just using a lubricated gloved finger, palpating the muscles. So starting very external, working through the 3 layers of pelvic floor muscles. And I'm looking for things like tight trigger points or painful spots that may cause pain there or referred pain. Sometimes they'll tell me it gives them an urge to urinate, or I might find laxity in the pelvic floor. And there's different muscles that can be tight and different ones that can be lax. And then I'll have someone do a contraction and try to do a Kegel, and I see all sorts of things, from squeezing just their glutes to just squeezing their inner thighs. Sometimes you see one half of the pelvic floor, the right side or the left side, contract better than the other side. And that could be a recruitment issue, or sometimes women tear their pelvic floor muscles and it's left undiagnosed. And so a lot of times we pick up on that when we see, wow, you actually cannot elicit a contraction in those muscles.
You're saying see, but what you really mean is feel because you're not
Feel.
looking, yeah.
Well,
So,
we need to look at the skin quality and all that, but yes,
mm-hmm.
feel.
And that's how you would do it with an adult female. How would
Yeah.
you do it for a male, and how would you do it for children?
Yeah, good question. So for a male patient, I usually have them lying in the same position, and I start with an external exam. So starting right at the groin and sinking into the pelvic floor muscles. And I always check externally with a female as well, because you kind of get different information. For a male, you can feel, are the muscles really tight and painful there? Are they lax? Um, I'll have someone contract and relax, and sometimes you can very clearly feel they isolate, and sometimes you can't. And then for a male patient, depending on the case, we may do a rectal exam. So having someone contract that way and relax, and feeling if a male is coming in with pelvic pain, a rectal exam is the best way to relieve these trigger points and teach them how to do self trigger point release at home.
Interesting. Oh man, that's fascinating because when I hear trigger points, what I learned in college, so I went to massage therapy college in Canada, which is very different from the States. It's like a 3,000 hour program. Um, and so what I learned about trigger points is that so correct me if this is the same thing or it's something different, but it's a small taut band of muscles that usually where the point of innervation is by the nerve, and that it is sort of cutting off circulation to which is creating referred pain. Is that what you mean by trigger
Yep,
point?
100%.
Okay. And so you can teach people to release their own trigger points from the pelvic muscles at home.
Yeah. So we do a lot of that work in the clinic, and I do use a technique called trigger point dry needling in some cases as well. But a lot of times people can use there's devices called vaginal dilators, or there's devices specifically made for the rectum that can be inserted, and they're kind of curved plastic devices that can kind of help you target these trigger points. They have massage tools like that too, where
Sure,
you're
sure.
you're putting pressure on different points. And so I have people kind of think of their pelvic floor as a clock, and they kind of go around that clock and find where are their trigger points and do these trigger point releases on them.
Oh, so interesting. Um, in Canada, in some of our provinces, you can be licensed. We call it a registered massage therapist, not a license. But we can we can basically be registered or licensed to do a vaginal massage, and it is. I mean, you have to go for way more training for it,
Yeah,
but that it's there's so much stigma around it, and yet
right.
there's getting that either right before or during labor prevents tearing.
Uh-huh.
And what I was so amazed by is that I was in labor, my OB did vaginal massage. She's like, "Hey, I'm here. We've got time. Can I do it for you?" And I'm
Yeah,
like, "Yes!" I was so
right.
excited. I mean, it's not like sitting down at a spa to get a massage, but I was so
Oh yeah, right.
excited that she had the extra training, and that she was knowledgeable, and then that's
Yeah,
something that, because the OB that delivered was not the OB that, I mean, our OB was happened to like be on vacation, when the baby finally came. So I got a different one I'd never met her before, but she was perfect. She was absolutely perfect. Sat down
yeah,
and said, "Can I
good.
do vaginal massage on you?" It was awesome. So I think we have a lot of stigma in our society. I think we're really afraid still. I think we're, in some ways, we look at, how we're, as women, how we're dressing and how we're acting in society, and we're not a prude, right? In
Right.
some ways, but then in others, it's like, what is going on? Like, we're still stuck in like 1930 when it comes to talking about our pelvic floor health. Like, we're so, closeted, right?
Right.
Or the idea of having a vaginal massage for health, right? Or
Yeah.
vaginal PT for health. So it's,
Right.
this is not sexual. This is health, and it's done by a practitioner who's trained and safe, and so just releasing that stigma, I think, is really
100%.
important.
And
Yeah.
it's really sad to me that this stigma exists like within the female culture. Like
Mm-hmm.
some of it is just historical, and sometimes like I think it's because pelvic floor PT is becoming more popular because women are finally talking about these things that, you'll see more things in the news. Like, um, I think it was Cosmopolitan last year had a big article on like childbirth injuries and just bringing awareness that this stuff happens. And unfortunately, and this isn't to throw any physician under the bus, but pelvic PT wasn't taught, or a lot of the like doula stuff was never taught in medical school for a lot of
Mm-hmm.
the doctors practicing now. And for me personally, and I'll get later on, I'll talk a little bit about just the postpartum, kind of the postpartum culture in our society. But I was blown away because here I had been practicing pelvic health for years before I had my own children. And I moved to Wisconsin, and I was pregnant with my twins when I was here, and I was going from doctor's office to doctor's office, introducing myself, marketing what I do, and getting very discouraged when OBs weren't sending their patients into me. And I thought, like, maybe they don't, have faith in what I'm doing or whatever. And then I had my kids, and I had a twin pregnancy and twin vaginal delivery. And I also was heavily trying to market to my own physician. And so I went into my postpartum eval showing, like, ready to tell her, like, I've done a self exam. This is what I think is going on with myself. I don't have a diastasis. I think I have this. Um, And we never even got to that part in the conversation, and I was blown away, and I realized doctors aren't not recommending pelvic PT because they don't believe in it. They're not even checking for the
Mm-hmm.
things that we see people for. And again, that's not their training. So, um, I kind of shifted my focus with marketing to educating physicians on why they should consider sending patients to us and saying, not only you have to examine them for this, but if a patient mentions this, that's a reason to send them to our office. And, they're
Mm-hmm.
checking for things at the postpartum visits, like, are you still bleeding? Do you have any signs of infection? They're looking for major medical things.
Right.
And so often, if you have incontinence, which by 6 weeks postpartum is not normal, that should resolve before 4 weeks postpartum. Um, they're not necessarily checking if you have a prolapse or if you have a painful scar. And I left feeling like, wow, I've been practicing for years in this specialty and I know what I have and I know who to go see for it. What if I didn't know that and for
Mm-hmm.
years wondered what was going on with me? And that's what I see oftentimes is people that I'm treating for postpartum issues aren't coming in 6 weeks or 6 months after having a baby. Sometimes it's years or decades after they've had a child.
I have a friend who's had five. She's probably listened to this, so hello. Five kids. Can she? I mean, can a woman who's had given birth to multiple children, even years later, go to a pelvic rehabilitation practitioner and see success?
100%. And to be completely honest, sometimes I've had patients that have big problems after their first baby, no problems after their second or third. And it's just varies and there's always things you can work on. Something that we do as moms, and I just recently did an Instagram post about this is, our postures and our muscles change while we're pregnant. And so oftentimes we have these compensatory movements or different movement strategies because our transverse abdominals are very stretched out, our pelvic floor has gone through trauma, our diaphragm's not able to descend as it's supposed to. And all of a sudden we're not pregnant anymore, but our body's kind of stuck in these positions and we keep reinforcing those movement patterns and we never take the time to rehab those muscles that need to be part of the pelvic floor and the diaphragm and the transverse abdominals should be these anticipatory muscles that before we go to move, they fire. They've shown these in healthy subjects that helps stabilize us. It helps keep us continent. It helps keep our breathing normal. Um, and if we don't go to correct those, so a lot of times I do see people years later, and they can do great. I always advocate for earlier intervention, but I think it's never too late. I've had people in their 80s and 90s even come in with incontinence that have gotten completely better.
That's really exciting. So, just to just to complete our conversation about the exams and sort of what to expect when someone comes in to see a you or another pelvic rehabilitation practitioner. For children, how do you do
Oh, yeah.
that examination?
So with children, it is not invasive at all. Honestly, with children, education is the biggest thing. It's a lot of education for the parents. And so a lot of these things someone could work on before that. So anyone listening that has a child that's having problems with bedwetting or incontinence, 100% start paying attention if your child is constipated. It is it makes everything. And when I say everything, like my adults with constipation have worse bladder leakage, they have worse pelvic pain, they have all of these conditions are compounded with constipation. So the biggest piece of advice to parents is make sure your child on a regular, having regular bowel movements, having enough water, having enough fiber, having enough physical activity. So that's the biggest thing with parents. A lot of these kids go to school and they dehydrate themselves all day long and they never want to take a drink of water because they're afraid that they are going to leak or they're just so distracted and busy at school that they're not doing that. One thing I just see a lot of teachers and a lot of students because they're not allowed to go to the bathroom in a lot of schools during a
Mm,
class, which can cause some problems for kids that really need to go. So a lot of it is just very basic things as far as making sure you're hydrated and not constipated. When children come in, we do a lot of, I have some children's books that have pictures of how the body works and how food and urine goes through your body. And um, We do things like toileting positions, and the child can be fully clothed, but we're working on, can you contract your muscles to stop pee? And then things to get the pelvic floor to relax so that they can void or have a bowel movement. We'll do a lot of things like blowing bubbles with it or learning these breathing patterns, doing it through kind of play.
I love it. I love
And
it.
so I will say I also do, you know, sometimes we'll check the perineum in the skin because we do need to check that the child isn't having this red, irritated, um, physical therapists in most states now have direct access. And so if I see something that looks like it potentially could be an infection, I need to send them out to a physician who can treat that. Um, and then I'll press along the groin if I have the child and the parent's permission and ask the child to contract and relax and to see if any spots on their body are painful.
Mm-hmm. That's very interesting. Do you have any advice for, so I mean it's hard because we don't know what's going on. Like I said, you don't just tell everyone do Kegels because that could be the exact opposite of what they might
Yeah,
need. So we can't just tell all children that are having incontinence like, oh, just like, pull like, imagine like you're pulling everything up into you, or try to give them some imagery because we don't know if that those are the right muscle groups for them to be exercising.
right. So one thing I just think, and we are very far from this in our culture, but nobody knows about the pelvic floor that it exists until there's a problem or until they're like having a baby. So I think it would be great if we could just teach children that there are muscles in their pelvis and that when they have to hold it, like if they have to go to the bathroom and they have to hold it to get somewhere, like squeeze those muscles that are holding that urine and feel what that feels like. And then that these muscles also have to be able to relax for them to be able to void or to have a bowel movement. Um, And I think the good thing with a child knowing that they have muscles that control this is when there is a problem, they know it. I see a lot of adults who just never knew it was an issue or that it was something they could help. And when girls get to puberty too, they're more prone for musculoskeletal injuries and different things just because of our development and hormonal factors and structural factors in our body. But we're never taught that.
Mm-hmm. Yeah, when I between the ages of like 15 and 18, once every 3 months, I was twisting my ankle, falling down. Like I didn't understand, and now I understand what was going on. My body was changing so fast that I didn't know where my
Yeah,
center of gravity was. But I was like, I just thought I was a klutz. And
right.
and I'm thinking back going like, I haven't tripped or had any of those problems in my, in years and years and years. And really it was just when, because our body is changing so much
Yeah.
during our teenage years, that we can be prone to accidents because everything's changing and we just don't know where we are in gravity.
And this happens again in menopause, actually.
Oh no.
So be prepared. No, so I think what happens is there's oftentimes changes on the pelvic floor, whether because of hormonal changes and things. Sometimes people can develop secondary vaginismus, like that pain I described before, but it's due maybe to hormonal changes or menopause, or they can develop incontinence as part of that as well, that they get vaginal atrophy. And
Mm.
at the same time, you see people losing their balance and having more falls. And one thing that I try to talk to other PTs about that treat orthopedics and want nothing to do with the pelvic floor is that those are not separate issues. Back pain, it's not a separate issue. If there's a problem with the pelvic floor muscles, you're going to present with another problem. So, um, I encourage PTs on their screening form and probably any practitioner to have, do you leak urine? Just a very simple question. And if someone's coming back and they've had back pain over and over, or hip pain over and over, neck pain, jaw pain, and you're not getting anywhere with the techniques, and you notice that they have, written that they are also leaking urine, there is a problem in those anticipatory muscles and their core is not intact. And so that needs to be treated as part of the problem.
As someone is walking, can you see in their gait that they have issues in their pelvic floor? Like, does it affect the body so overtly?
That is an interesting question. So you can definitely in their posture. So yeah, people move definitely different when they have a problem at their pelvic floor. So you can tell sometimes how someone is standing. And I always look at posture when I'm looking at a patient because oftentimes someone stands in that posterior pelvic tilt or their tailbone kind of tucked under. And if anyone listening right now goes into that position and they try to contract their pelvic floor, what you'll feel is kind of maybe a little bit of a contraction around the anus, but a lot of the gluteal muscles contracting. And then if you come into a better seated or standing posture with more of a neutral spine, kind of restoring that lumbar curve, you try to contract and you can feel that that contraction moves anteriorly and that you're actually getting your pelvic floor muscles. So oftentimes positionally, even with gait or just static standing or sitting, um, we can kind of change the body's ability to recruit these muscles.
Oh, that's so cool. I had a question pop in my mind. I'm not quite sure how to form it. More people than we are aware of have suffered from sexual assault.
Yes.
And it's again one of those topics that, I mean, it's still not completely open, right? It's
Right.
unfortunately the victims are left to feel like it's their fault and they're ashamed of it. And some victims even have it in childhood.
Yes.
What have you ever had patients who've come to you with pelvic issues and it is in the discovery you find out that they were sexually assaulted? Or
Yes.
does the sexual assault, can that injure the pelvic floor, or I guess the emotions around it cause them to not cause them to use their muscles in a different way so it creates an injury?
Yes, 100%. So traumatic events like that can cause people to develop these holding patterns. So that clenching of the pelvic floor, people clench their jaws or, like those upper trapezius muscles, you can get trigger points and the pelvic floor is no different. And oftentimes if someone has been sexually assaulted, they have been holding that pelvic floor tight and trying to protect themselves.
Hmm.
And they do develop pain. They also have a lot of psychological damage done from that. And I have seen this in my clinic, probably more often than I'm glad they come in, but it's sad. And what I do with these patients is I always tell them that you do not have to do internal work if you are not comfortable with it. And I say that to anyone, whether they're traumatized or not. I explain that for me to get the most information from this exam, an internal exam is what is best. But if someone's not comfortable, that's not best for them then. And
Right.
a lot of these patients, I explain to them, like, let's start with working on diaphragmatic breathing because you probably have never breathed into your belly ever. Or let's work on some of these stretches, like happy baby pose in yoga is one of my favorite for opening the pelvic floor. And um, sometimes just having their feelings validated as someone that's willing to work at their comfort level.
Hmm.
I 100% of the time make sure that they have seen a psychologist or know of one or get a referral for one. And I explain to them that that is not my specialty and that I am there to walk them through this and to work with them. But it would be beneficial for them to also see someone that does that. And honestly, these patients do great because you can give them the tool they need. So if it's something like you need to work on this on your own at home and that's what they're most comfortable, sure, they come back, less frequently and you progress their exercise program and you answer their questions. Um, Oftentimes these patients end up becoming more comfortable and allowing an internal exam and internal work. And what I really work on in those exams, we don't do it for very long, so it'll be very limited treatment there, and I make sure the patient stays present with me. So one thing I've noticed in my patients, and I have one that's particular in my mind, she all of a sudden I'd see her eyes kind of go up, and it was like she wasn't paying attention anymore, and I could tell when she was dissociating from what was happening in her body. And it
Mm-hmm.
it had been a technique that she had learned because she had to. She had been abused for so long, and so I try to keep people present with me. And is this painful? If I move your leg this way, or if you contract and relax, or if we add pressure here, does that decrease the pain? And I keep this conversation going of what makes the pain better, what makes it worse, and let's find a technique together. Try to breathe into that spot, and keep them there. And sometimes you can only do that for a couple minutes before the person's gone, but they continue to improve in that. And I think getting back in their bodies, and working with a psychologist on that is just hugely important as well. But that can really be beneficial for them because they've spent so long just tightening up and blocking people and blocking themselves from feeling anything.
Have any of those patients shared with you that that they were surprised that the pelvic physical therapy was cathartic, was a healing process for them emotionally?
Yeah, so I actually have had several patients that I don't even they weren't even sad. It was just like these tears would just come out and um you know more so like I can't believe I don't have pain right there. Do you know what I mean? Like as they're
Mm.
getting better and doing that. And I've actually had an experience with a patient who didn't really know that she had been sexually traumatized until very recently, and she had been by a priest, and she blocked that out of her head, and she thought because it wasn't sex that she hadn't been molested. And when recent news had come out and people were talking about it, all of a sudden she had this breakdown because she had been molested in her childhood, but had made excuses for it and kind of blocked it out of her head. And she happened to be seeing me at that time. And so we actually took a break from physical therapy completely for her to do more talk therapy and working with her body in ways with psychotherapists. And then she came back and did fantastic. But it was this, she was coming in for bowel and bladder symptoms, and it wasn't what she was expecting was related to it.
So were the problems because she was holding herself so tight for so long for to protect
I think so.
herself?
Yeah. Well, I think that played into it. She also had a couple children in that time, and that, but I think for her it was a lot of urinary frequency and difficulty fully emptying her bladder and a lot of things that go along with having a tight pelvic floor.
You see these commercials that are like the Depends, like the adult diaper commercials, and they make it sound like is this is something to expect, especially for women when they're in their golden years. I know you've said that you've had even women in their 80s come in, but you know, they're making it sound, the marketing is making it sound like when women are older, they're supposed to pee themselves.
Right.
And what you're saying is that it's common, but it's not normal or healthy. It's like if
Right.
50% of the people had a limp, walked with a limp, we would say it's common, but that
Yeah.
doesn't mean it's normal. It's not supposed to be that way. So it's like people are walking around with an injury and we're being told by all the marketing that this is normal. It's just part of aging, or it's just part of having kids, or it's just part of life. But
Yeah.
it's actually an injury, an imbalance we're walking around with, and that it is not optimal health.
Yes. And I mean, we see this in every industry, but people are making billions of dollars off of this. So why would they want you to know that you could get that you could get better? But 100%, it is common, but not normal. And I think we kind of put it in our heads like it's either after a baby or as we're getting older, and that's when it's normal to experience this. And it's not normal in either of those cases.
Now, I haven't yet gone to a pelvic rehabilitation practitioner because as I'm thinking about it, I've been putting it off because it's not that big of a deal. So what? I pee a little when I laugh, no big deal. I'm busy, I'm, a mom and I'm an entrepreneur and I'm putting, my business and everything else kind of, I'm just seeing this. I'm looking at my own thinking. I'm thinking like, how many women do this where we're putting everyone else first and we're really kind of putting our health on the back burner? And I kept saying to myself,
100%.
I'm gonna go to one, I'll go to one eventually. Like, it's sort of this in the future when I have some free time, I will make time for my own health. But how many of
Yeah.
us do that where we like now that my listeners know about, pelvic rehabilitation, don't be like me and put it off for years because but what you're saying is that it's the incontinence is a symptom and that the problem can be far greater even though you're just the only thing you're seeing, maybe you're not having any discomfort or pain, but maybe you're just seeing that you pee a little when you laugh, but that it is actually causing more damage. Can you talk a little bit about that? Like, what's the damage
Yeah.
of continuing life with this imbalance?
So it can vary. So obviously, like the incontinence can become worse. But you have to imagine, I like to describe the core as like a soda can. And if you imagine you have the respiratory diaphragm on top and the pelvic floor on the bottom, and then you have the transverse abdominals coming around and the multifidus on the back. Those four muscles make up your your canister, your core. And these muscles should contract first and they should stabilize and allow you to move from there to prevent injury anywhere in your body, really. But they keep us continent and it keeps us breathing well. And like a soda can, if you imagine, pop open that can. So whether it's a diastasis recti and you have lost your abdominal tone and you have this bulging or herniation at your abdominals or a pelvic floor weakness, now how easy is that can to crush? You have no stability there anymore. So it's really a balance of pressures in our body that's there. And there was an article in the medical research, and I'm just going to read the title of it because it's my best article to bring to a physician's office and say, look at this, it changes what you think. So they found that disorders of breathing and continence, so if you think the diaphragm and the pelvic floor, have a stronger association with back pain than obesity and physical activity. So, what do we tell people when they have pain in their body? You need to lose weight, you need to exercise, these things. But these disorders of the diaphragm and the pelvic floor are more associated with back pain than any of those things which are important as well. So, it's a huge problem. One other thing, as far as how you said, like, you don't get help for it and all of that, and how our culture kind of feeds into this, it's a little off that path, but I think with postpartum women, we are constantly marketed to how fast can you lose your baby weight and how great can you look right after you have a baby. And some of these workouts, I mean, if you're on Facebook or Instagram or any of those, like how many times a day are you marketed like join me and lose all this weight, um, and there are these hard exercise that people are doing. And a lot of these women have never rehabbed their pelvic floor or their transverse abdominals. And I am someone that believes that people can get back to everything after having a baby. I think after um, most of this, that if you rehab correctly and you improve your movement patterns, the goal is to get back to all this. I would never want to tell one of my patients they have to stop running or they have to stop doing anything. But when I was working in Maryland, I was asked to talk at a CrossFit gym, and I was a little taken back because at first I didn't know how this would go because I would see some of these women in these CrossFit gyms doing exercises that I knew they probably shouldn't be doing. So one thing I was asked in Maryland was from an owner of a CrossFit gym to come in and talk about peeing while you exercise. And know how to approach it exactly because I knew a lot of these women were peeing while they were exercising because they had never rehabbed themselves properly to be able to do the type of activities they were doing. And I said, "Oh, that's not normal. I'd love to talk about it." And she said, "Well, really, it's not normal. You've got to see these YouTube videos." And she sent them to me. And it was these interviews of someone at these CrossFit competitions going up to people and going, do you have the workout peas or do you pee while you exercise? And all these women like, yeah, I lift all this weight. I do all these hard exercises. I totally pee my pants. I'm wearing a diaper right now. And I'm thinking like, what are we promoting in our culture that makes this seem like it's a good thing or normal? Um, and so it took a lot to get these women to step back and, I said, this isn't that you're never going to do these exercises, but you need to step back and learn how to move better before you can get back into these exercises. And there were people that came up to me and said, I'm not going to come see you if you tell me I have to take a break from this. And of course, they never came and saw me. But I do challenge people to think about it. We think about the pelvic floor so different than other parts of our bodies. And if you strained your hamstring and you were playing a sport, you would rest, you'd work on stretches and strengthening, maybe you'd ice, you'd do all of these things to rehab, and you'd gradually get back into your exercise or into your sport as you could tolerate because your hamstring was your weakest link. You wouldn't push past it and further injure yourself. And if we think of the pelvic floor as the weakest link in these situations, exercise to to your weakest link. So maybe you can do a certain amount of reps or a certain amount of weight and stay continent, and you gradually increase that. But the second you
Mm.
train your body, I'm going to just keep jumping 800 times in a row, or I need to lift this weight that's so heavy and I completely lose bladder control. You're not training your body to move better.
Interesting. I've worked with trainers before, and they always start with the core. They're like, okay, before we do anything, we're going to strengthen your core because there's no point in like having you do deadlifts or whatever when you have a weak core. Like,
Yeah,
your core's, everyone thinks when you say core, muscles, like what are your core muscles? Well, my abs, right? And my back. And so everyone thinks it's like your abs. So let's work on your core, your abs and your back and maybe your butt.
hmm,
But no one thinks about the pelvic floor as being part of their core. And that's
right.
interesting because when it was described to me by Jennifer Saltzman, who's been on the show before, she's Pilates, like 20 plus year Pilates instructor, and
Yeah,
she says the pelvic floor, imagine it's like a big salad bowl that's sitting in your pelvis, holding everything up. Right, it's holding,
yeah,
your bladder and your bowels. It's holding, and your uterus for women, right? But it's holding
right,
everything up, and it's a big salad bowl. And she helps people to understand that, like, they're walking around with their salad bowl like spilling out because their salad bowl is
right,
tipped forward or tipped to the side, or so looking at and respecting that the pelvic muscles are just as important as our, it's actually part of our core.
right.
They're just a bit more subtle. You're not going to do like crunches.
Right. Well,
Right.
and the thing that people don't realize is that the rectus abdominals are not part of our core. They're a very external muscle, and everyone wants them because it gives you a six pack, but that's not part of our core. And so if you just work on your rectus abdominals, you're not strengthening your core.
Mm-hmm. And your core is needed for stability.
Right.
And so you're saying that those with a weak core end up injuring themselves more, or like as they get older, they're more prone to falling and injuring themselves.
Yeah. And it can go the opposite way too, how we talked about kind of fixation or immobility. And so we need our pelvic floors to be mobile and stable. And it is this constant kind of balance because we need our muscles to be very mobile. We need them to expand to have babies and to have bowel movements and urination and all of that. And we need it to be stability to move and do all of those things. And so when we end up at one side of the spectrum or the other, whether it is a very weak, stretched pelvic floor, or if it's a very hypertonic and painful pelvic floor, we're going to have problems in both of those situations.
Is this kind of physical therapy fairly new, or can you see when looking back in history that there are types of therapy, or there's type of cultures that focused on pelvic floor health throughout time?
Yeah. So I don't know when pelvic floor therapy started in the US. I know I've been doing it for 10 years, and there have been therapists doing it way longer than that here. There are definitely techniques taken from other cultures that we've learned about, and I think some midwives in other cultures have been doing some sort of rehab for the pelvic floor. This isn't really to speak to the historical aspect on it, but one thing I really was blown away by is I used to work outside of Washington, D.C., and I had the luxury of working with people from all over the world just because their jobs took them there or their partner's jobs or whatever. And it was eye-opening to me because I had a lot of patients from places like France and Germany that would come right after their postpartum checkup. And I'd say, "What brings you in today? What's the problem?" And they say, "Well, you tell me. I'm here for my postpartum checkup." And it was so refreshing. And some of these patients needed ongoing PT for a little while. And some of them, I gave them some tips. We worked on their posture, made sure things were moving well. And I said, call me if you have any of these problems in 8 weeks or whatever. Um, but it was just so ingrained to them that having a baby is a physical event and you need rehabilitation after, and that you're going to go because why wouldn't you take care of yourself after an event like that? And it's just not the way it works in the US. We don't support preventative medicine, and we don't necessarily take care of our moms
Hmm.
after they have a child. We're looking at getting people back into the workforce as soon as possible and losing your baby weight as soon as possible. And I think that's just really damaging to women. I think more and more people are talking about it now, and there's definitely a huge demand for this type of therapy. And I encourage any physical therapist who is at all interested in working in this to get some training, even a course or two under your belt, so that even if it's enough to just help the most basic things and then know enough to refer someone to someone more specialized later, because there are just so many people not getting help.
Absolutely. I've talked about this before on the show with other practitioners, looking at the history of modern medicine. So I won't get into it too deep, but it's a very interesting topic to dive into to understand what's influencing our modern day practitioners. So, like you say, we go to an MD or your OB and we're expecting them to know about other resources. So, if we tell them we're peeing when we laugh, they should know to tell us to go for pelvic rehabilitation, right?
Yeah,
That they should know that. But if we
right.
look at, and I'm not vilifying MDs or any doctor. I think there are individuals who get into medicine because they really do want to help people. We
Yeah,
have to look at the system. So 100 about
right.
100 it was like 1910 around there the Flexner report was created, and people can go on wiki and see this, but Carnegie, who was one of the richest, maybe he was the richest, I don't know, one of the richest people in the United States at the time, owned a pharmaceutical company, and he wanted to influence the marketplace. And so he had a man go all throughout the United States, create what's called the Flexner Report, which is a list of, was at the time a list of all the doctors who were practicing allopathic medicine, which is a pharmaceutical based medicine. At the time in history, we have to just imagine like what we know now is not what the world was like back then. Back then, you could go see what is now, we go see a chiropractor, osteopath. You could go to an herbalist or a homeopathy practitioner, and the everything was an even playing field. You could go become any of these different types of therapies. You could become a student of them at these universities or these colleges, and everything was an even playing field. Then Carnegie invested millions of dollars. He put colleges out of business. He told the colleges and the universities that he gave his money to that they had to stop teaching anything that had to do with basically types of therapy that conflicted, that competed against the pharmaceutical medicine. And so he was able to change what we know now as he created what we know now. Basically, everyone goes to an MD and everyone is put on a drug. 70% of adults in America are on at least one prescription medication. We, we grew up in a system and we didn't realize that. We just think it's normal. You go to an MD, you get a drug, right? So,
Right.
so, but back in 1910, right around then, is when he was Carnegie was influencing all of the schools. So the schools were influenced to teach a certain curriculum that he agreed to, which would then teach doctors to push the drugs and not natural therapies. So if you have a bunch of people who are peeing themselves when they get older, right, then you can
Yeah.
sell them a drug that might but that might prevent peeing, right? So you could sell them a
Right.
drug or sell them diapers or whatever. But
Or surgery.
or thank you. So I'm getting to that. Surgery is another thing that they can sell you. And so why would they? And again, I'm not vilifying an individual doctor. Maybe listeners have gone to their doctor and told them that they pee themselves, and the doctor said, well, we have a drug, or you have diapers, or this is just normal, or here's a surgery.
Yeah.
This is what medical schools teach, because it would harm the profits. Think about it. It would harm
Yep.
the profits if medical schools, if doctors learned how to cure people so they no longer needed drugs or surgery, then that would put industries out of business. And so it's really the whole system. is set up in a way to keep people stuck. Now, I think there's a lot of good people in the system. I think a lot of people are breaking out of. I've interviewed a lot of MDs that have broken out of the system and gone, wait a second, there's way more than just drugs and surgery, and what am I doing?
Yeah.
And at the same time, I love that drugs and surgery are available should I need them. So we want it, but it's only one tool. It's only one tool. It's not the only tool.
Right.
So it's one tool in our tool belt, and there's 100 other tools like what you do, which is get to the
Yeah.
root cause and help people heal at the root level. And so I want all the doctors listening and all the patients listening. Let's educate our doctors and let them know that there is a better way, that we don't have to get on a drug or get a surgery for this, for peeing ourselves, right?
Yeah.
That, or if we have pelvic pain, that there's a viable therapy that gets to the root cause.
Right. So I actually have had the experience of working with some absolutely fantastic doctors and learning from them too, and being able to observe some of these surgeries and coming in for their exams and having these discussions. And I think more and more doctors are learning about this. And to their credit, like you said, they did not learn about a lot of this in
Mm-hmm.
medical school. Um, my entire practice up until this past August was in private practice. And for the first time, I'm working as a pelvic floor therapist in a hospital system. And it has been wonderful to work with
Nice.
physicians and to start programs and talk to doctors about how we may be able um, to help each other. And so, one thing with surgery is for a long time with prolapse, patients were just that was their option. That's it, do a surgery.
Mm-hmm.
And I think depending on the doctor you go to, a lot more are saying try physical therapy first. And a
Nice.
couple of my favorite surgeons in this area are huge supporters of pelvic floor therapists. And really, it makes sense because if you only do surgery on the people that need that surgery, you're going to have better outcomes yourself as well.
Mm-hmm.
One thing I'm really working on educating both patients and physicians in right now is the idea of pre-op surgery. And so like prolapse, for instance, I am not going to say that everyone that walks in my door, I cure their prolapse. And like I said, I don't even take credit like that. I teach them to do things. And I have some patients whose symptoms are 100% resolved and they never need to have surgery. And I have some patients who are kind of borderline. We'll see how you do in therapy. And I've had patients that come in off the street into my clinic and I have them bear down and their bladder is physically coming out of their vagina. And I say, I have a name of a great surgeon I'm going to send you to, and I think you should strengthen your pelvic floor as part of your rehab. So I think it's knowing each other's specialties and who you can help and who you can't help. And I try to educate my patients that if you go to somebody, like my favorite thing is when a doctor says, I don't know, let me find someone that does, or I don't
Yes.
know, let me look that up because it's scary whether you're going to a PT or a chiropractor or a doctor. If they think they know everything, that's frightening to me. I'd much rather have a doctor say, "You know what? That is not my specialty. Let me give you the name of somebody who it is." And I would much rather hear that than unfortunately a lot of doctors still when they don't know something, they dismiss the patient's complaint and um, one thing that just breaks my heart that I just hear over and over still is a patient will go into her OB or her primary care doctor and say, I'm having painful intercourse. And that when you say that, you've become very vulnerable. You're opening
Mm-hmm.
up to a very private part of your life. And I can't tell you how many times a patient comes in my door and either recently or years earlier, their doctor's advice to them was you just need to have a glass of wine and relax before you have sex with your husband.
Oh my
And I
gosh.
just think when I mean, it's 2019. Like, if someone's willing to open up about that, find someone that can help them. I mean, even if you think it is in their head, send them to a psychologist. But there are physical reasons for this pain, and um, I'm never under the belief that everyone will get better with what I do. I do need to refer out to other practitioners a lot, and I think that working together is something that our medical community needs to do more of.
Yes, and that as a patient, we should have the idea in mind that we are creating a team of holistic experts to surround us, or a team of experts to surround us. Hopefully, a
Right.
lot of them holistic, but a team of experts, and that we want them to talk to each other, and we want this team to inform us and help us to make the best choices. And then we ultimately are the final deciders in the therapies that we're going to participate in. But that a doctor is not up on a pedestal. If their
Right.
doctor is hubris or an ego, then just fire them and get one that says, like, that has the that that can step down from their ego and say, you know what, I don't know the answer. Let's go get the information. Let's go find out.
Right.
So
And
many.
there's a lot of dangerous stuff by Googling stuff. One positive thing is, so you can't find a doctor that's doing that. Go get a physical therapy evaluation. A lot of times, most states don't require a physician's referral. And if your particular insurance does, call your primary care doctor or someone, any doctor, you know, really, a nurse practitioner, and have them write a script for physical therapy. It's rare that someone would say no. And when you go to that specialist, whether it's a pelvic PT or whoever you're working with, and you have a problem, they probably have a physician to recommend for you because there are a lot of fantastic doctors out there.
Absolutely. You're just reminding me of Kristen Bowen. I don't know if you've listened to her episodes. She's the magnesium soak
Oh,
lady.
yeah, I've heard a little bit of it.
Right, yeah. So, she, all her health troubles started with getting, she told her sisters that she was, she had given birth to, I think, three children at that point, and her, she started, peeing after laughing, that kind of thing. And her sisters went, oh yeah, it's time for you to go get the surgery. And so she went to the doctor, and the doctor's like, yep, no problem. Let's go do the surgery, where they took, tissue from from a cadaver
Yep.
and made a little hammock and put her bladder in it, and then used titanium like screws to screw that little dead tissue hammock
Uh-huh.
to her pelvis, to the bones in her pelvis. And when she woke up, she started having, I think, 30 seizures a day for two or
Oh my
three
gosh.
years, and she got down to she was like 70 something pounds. And um and then they finally convinced a doctor or surgeon to take it out, to remove it. And then most of her seizures went away as she got down to 3 seizures a day.
Wow.
And she thinks she had an autoimmune response to the titanium and also the tissue that was used. It
Yeah.
turns out that they think that it was black market tissue because it was
Ah,
not tattooed with a code on it, which it was supposed to.
okay.
But just there was no she was not given any choices other than,
Right.
she wasn't told, like, let's even get examined by a physical therapist that specializes in pelvic rehabilitation, or let's even just give it a few months of exercises and see if that improves. It was just immediate. Oh yeah, you're peeing when you laugh, okay, it's time to get the surgery. And I
Yeah.
understand that, like you said, prolapse, like if the bladder is coming through the vagina, then okay, there's
Yeah.
maybe, like you're saying, maybe it's so far gone that PT wouldn't help that person get back to where they need to be, but that they can use the physical therapy as rehabilitation. But surgery should always be, unless it's life threatening, surgery should also always be a choice we make after we've tried other options, like tried a few months of
100%.
physical therapy.
Yeah.
And I feel like it should be mandatory, like if it's a surgery that isn't, like I said, life threatening, it should be mandatory that we at least try a few months of physical therapy first to see if we could make headway or see if we could prevent the surgeries, because surgery is really dangerous and
Right.
life altering, life changing.
Well, and that whole idea of having physical therapy first, and I try to tell my patients, and like I said before, it's something I'm working on that I didn't get too much in it. But when you tell someone like this might be able to prevent you from having surgery, and I always tell my patients, worst case scenario, you still need the surgery, but you're rehabbing your pelvic floor and you're learning new movement patterns and you are learning how to properly void and not strain when you're having a bowel movement. And all of these things you're doing are going to optimize the results of your surgery. You're changing the things that are contributing to your prolapse in the first place. So when you have that surgery, you're not going to need it redone right after because you're going to know how to move. And it just gets me when I get someone that's post-surgical and they have been straining their entire life. Well, how did someone have a surgery for a prolapse and have not been taught how to toilet without straining? That's just
Mm.
contributing to the issue. So I feel like preoperative physical therapy can not only do that, but in my men with prostate surgery, if these men came in for one visit preoperatively, I think we could cut back the number of PT sessions they have after, because by the time they come to me, they've developed very poor bladder habits, and things a lot of people do anyway. But if they knew not to do those things and they knew how to do a proper Kegel, so when that catheter is pulled, they can start strengthening right away, they would just be less frustrated, more educated, and kind of prevent some of the secondary problems that they can cause with their own habits.
Mm. What about hernias? Can pelvic rehabilitation help with preventing or help healing hernias?
So I treat a lot of patients for diastasis recti. If someone has a true hernia or like umbilical hernia, they usually are also seeing a surgeon depending on how severe it is. So I'm not sure the answer to that question actually.
Mm. Can you, for those who don't know, and I know because I've had it, but for those who don't know, can
Yeah.
you explain what diastasis recti is?
Yep. So diastasis recti is a split in the rectus abdominal muscles, sometimes during pregnancy or men with beer bellies or women with beer bellies, it's not just pregnancy, can cause a tearing in the linea alba or that kind of white fascia when you see a picture of the muscular system between the abdominal muscles. And when that splits, you see a bulge there, or you can usually sink a few fingers in between, and that's how it's measured actually. So it can disrupt how you're moving and how load transfers through your body.
And you can help people to heal it.
Yeah.
Very cool. What about inguinal hernias?
The only patients I've seen with hernias either had a hernia repair or they were sent to me with a questionable hernia. And by working on the pelvic floor and the core, their symptoms went away. And I'm not actually sure that they ever had a hernia.
Thank you. That's what I was getting at because
So
a
I
lot
think
of
it's
hernias
more
are,
of a
yes,
misdiagnosis.
misdiagnosis. I was misdiagnosed with a hernia and it was can you say it?
Diastasis recti.
Thank you. Diastasis recti, which is really common. It's really common for people to
Yeah,
have or, having some symptoms in their pelvic floor because it's out of balance and it's appearing like it's a hernia and you do the work and then the symptoms go away. So we don't need to know if it was a hernia or not because you strengthened whatever was weak.
right.
Very cool.
Yeah.
This has been wonderful. I like it when practitioners share some kind of tips or exercises, but I'm getting the feeling that it's really personalized. Like you can't tell us all to do Kegels because that could be making it worse for some people, but making it better for others. So, is there any kind of advice or like very general applying to 100% of the population exercises or advice that you can give us?
Yes, 100%. So the first thing I kept talking about how with constipation that people strain and can't have a bowel movement. So if anyone listening is sitting down, I am a huge fan of those squatty potties. Have you seen those? They have
Yes,
them at like Bed Bath& and Beyond
every
and
toilet
everywhere.
in my house has a squatty potty.
Same with mine. Um, so that's great. You want your knees above your hips. You want your pelvic floor to be able to relax. But if everyone listening tries to do kind of like a Valsalva or a pushing a bearing down motion, try doing that, and you're probably holding your breath. So as you do that and you're holding your breath, what is your pelvic floor doing? So when you're doing that, you should feel like the pelvic floor is contracting and actually lifting up, right? So that's not allowing for a bowel movement. Now, if you sit and you let your abdominals relax and your pelvic floor relax, and I want you to blow out as you bear down, like you're blowing bubbles. So not a forceful air, but just. And now, do you feel your pelvic floor
Oh,
dropping down and
yeah.
widening? How simple is that? I mean, that is something I work with patients who are coming in from GI doctors and surgeons and different people. And I'm like, wow, you're an adult and I had you just pretend to blow bubbles and we've just fixed your constipation problem. So that's a big thing, this breath holding pattern, that reflexive tightening of the pelvic floor. So that's one thing I like to tell people. Um, Another thing is because it's such a common issue with bladder issues, some very, very simple things that a lot of us have just been taught wrong when we were children is, well, first, stay hydrated. Um, the general recommendation is drinking half your body weight in ounces. I think this varies a little bit between people, but in that fluid, that doesn't mean drink half your body weight in soda. It means you want at least two-thirds of your fluids to be plain flat water, so no carbonation. Um, and then, you can have some things that have bladder irritants in, but if you're really having a problem, watching those bladder irritants. So everything good, like caffeine, carbonation, sweeteners, acidic foods, tomato products, some spicy foods. Some of these things can irritate our bladder and want the bladder to contract sooner and empty. Um, so paying attention, like if, some people don't have a problem with that. But if it is contributing to your issues, making sure you're at least diluting those irritants by having a good amount of water. A big thing I actually just had someone come into my clinic and I was like, oh no, go home and tell your daughter you didn't mean that. She's like, I always teach my daughter never to sit on a public toilet. And what we're training to do, it's very different than in third world countries where they have this deep squat that relaxes the pelvic floor. When you're hovering over a toilet seat, you are in a contraction and you're
Mm-hmm.
teaching your bladder it's okay to contract and relax. And she said, but she could get all those diseases from the toilet seat. And I just laughed because I've never heard of anyone catching a disease from a toilet seat. And I personally want to make a public service announcement that the toilets would be a lot cleaner if everyone just sat down on them and stopped peeing on them on the seat. So maybe that could be the takeaway. And then no going just in case. So, I mean, I have to catch myself saying this to my own children, but every time you leave the house going just in even maybe you went a half an hour ago, but you're going to go just in case. Or you get to a store and you see the bathroom, so you're going to go just in case because you would hate to have to avoid half an hour into your shopping trip. What you're training your bladder. So what's normal is that the bladder fills to a certain capacity. So if you're training your bladder, say it's only half full, but you're letting it empty um, every time it gets to that point, or way sooner than you're even getting that first initial signal that you need to go, you're now training your bladder that when it's at that capacity, it needs to contract and empty. And so people come in saying, oh, I've always had a spoiled bladder. I've always gone all the time. They've trained their bladder to do this. And so by just starting by when you get that first urge, now, what's normal is 3 to 4 hours. So if you're getting it within that time, of course, you need to go and void. If half an hour after you went, you're getting this message, see if you can just distract yourself, do a few quick pelvic floor contractions, um, give yourself positive affirmations, see if you can even stretch it 15 more minutes, and you're gradually training your bladder to get back to that normal um, bladder interval. That can be huge. It can prevent a ton of problems with urinary frequency. So those are kind of like everybody could learn from those, and moms need to and dads need to stop telling our children to keep going just in case and never sit on toilet seats.
So I laughed there because in my mind, you just made the bladder be like a lithium ion battery where you can't, you don't, you want to wait till it's fully empty and then fully recharge it, not just plug it in every time it's at 75%. Like,
Right,
so you don't just go pee when you have a 25% full bladder. You should wait till the bladder's full and then go pee because it helps tonify and stretch the bladder.
right.
That's some pretty good advice right there. I have been doing that a little bit with our son who's 4, because it's like I don't know when he's gonna need to go pee, and sometimes he goes like hours without needing to go. I'm like, it has been like all afternoon and you haven't needed to go. Like you should go right now. And he's like, I don't need to. I'm like, you should go. You haven't gone enough.
Yeah. Well, and kids sometimes develop holding patterns, so
Mm-hmm.
that's important too. And it is tough with kids. I have 3 kids within 11 months, and I'm not going to lie, when we have to stop and one of them has to go potty, it is extremely inconvenient and very challenging to have all 3 of them in a stall. So sometimes I don't follow my own advice, but I feel like the best we can.
Do the best you can.
Yep.
Excellent. I like it. Um, wow. Thank you so much,
You're
Katie, for
welcome. Thank
coming here.
you.
Absolutely. You've shared a lot of great information. Did we get to everything that you wanted to share? Was there anything else you wanted to make sure that you covered?
I think I covered everything I was thinking of. The one thing maybe I'll maybe I'll mention just for people who like numbers or someone out there who's just learning that this is common is some of the recent statistics in the research, just as far as after childbirth, what women are experiencing. So 24% of women have pain with intercourse a year and a half after childbirth.
Dear Lord.
77% have persistent back pain a year after childbirth. 49% experience urinary incontinence 1 year after childbirth. So that's half of women are experiencing just what you said. They're talking with their friends, they're laughing. You know, you have a baby and you go home and you pick up these heavy car seat carriers and you're doing all of this stuff. And so it's not that surprising, but these are all reasons. 29% of people have undiagnosed pelvic fractures after having a baby, and 41% have undiagnosed tears in their pelvic floor muscles. So just if you are pregnant out there or having children or had them 10 years ago, if you are having any of these problems, to just get yourself looked at and evaluated. And um, I am happy, to the best of my knowledge, to give you resources on how to find someone who's trained in pelvic floor therapy and kind of be available. And like Ashley said, I'm on her Facebook page. So if you have any follow up questions or anything like that, I'm happy to try to help you find someone near you.
Yes, please come join the Learn True Health Facebook group. You can go to learntruehealth.com/group, which will redirect you to the group, or just search Learn True Health in Facebook. Katie, we're going to make sure that your information is in the show notes of the podcast of Learn True Health, so those who want to connect with you can. I know mainly you work with people one-on-one. Obviously, you like to see them physically, but I know that you have also worked with some people over Skype as more of a consultation to help them
Yeah,
to find the right practitioners for them. And so for those who would really like to reach out and talk to you, we're going to make sure that your information is in the show notes of the podcast at learntruehealth.com.
perfect.
Excellent. It has been a real pleasure having you here today. And I just want to implore the listeners to please share this episode with your girlfriends or your the female family members of yours who are pregnant or have had kids, because the more we spread this information, the more we can really finally get this to be, like you said, 50% of women are basically having pelvic floor issues even a year after birth. So half the population should really be seeing a pelvic floor specialist for one thing or another, just to, even if
Right,
we can just do some correction. It's like going to the gym for our pelvis, right? And do some correction,
right.
strengthen and stretch the right muscles, and hopefully prevent a lot of things from going wrong in the future.
Yeah, and we've talked a lot about how behind kind of our culture is in treating these conditions or talking about it in women. And if we think women have it bad, men are like in the dark ages still, because it's now doctors are starting to recognize these things in women, but these poor men are. I can't tell you how many times I see someone for pelvic pain, and when a man has pelvic pain, 95% of the time they do not have an infection, and 5% they have actual bacterial prostatitis. And these men are given round after round of antibiotics and told that it's prostatitis. So I just wanted to make that last mention because, you know, I probably see 70 to 80% is female and 20 to 30%. So I do focus a lot of my education on females, but these men, they need help too. And I feel like there's not enough people talking about problems that men have.
Right, because there's shame there. It's like, having pain in that area, and then you go to a doctor and they're like, okay, well, it's probably an infection. Let's treat it. And like you're
Yeah,
saying, most of the time it's not an infection. It's a pelvic floor issue. This is
yeah,
just eye-opening, and getting on round and round of antibiotics that aren't needed is so damaging.
it is.
Yeah.
And discouraging, not to mention if you keep seeing someone and you're not getting better, it's depressing.
Mm-hmm. Right. And you said that there's a increased chance of depression and suicide in people
Right.
who suffer from this pain. Well, you're doing some really important work. I'm very excited that I had you on the show today, and we allowed everyone to know and shed some light on this very important topic. And I'm excited to continue this conversation in the Facebook group, the Learn Health Facebook group, because I know we'll have a lot of great listeners wanting to thank you and also wanting to share their own experiences. So thank you, Katie. This has been great having you on the show.
Thank you. And thank you for allowing me to talk about this. It's actually Pelvic Pain Awareness Month. So, my passion in this lies in educating people and teaching them about this. So, thank you for giving me that platform.
Yeah, happy Pelvic Pain Awareness Month. Are you looking to optimize your health? Are you looking to get the best supplements at the lowest price? For high quality supplements and to talk to someone about what supplements are best for you, go to takeyoursupplements.com and one of our fantastic true health coaches will help you pick out the right supplements for you that are the highest quality and the best price. That's takeyoursupplements.com. takeyoursupplements.com. That's takeyoursupplements.com. Be sure to ask about free shipping and our awesome referral program.